When tennis elbow strikes, it can be very painful. And in fact, many people wonder exactly how it was caused or what they can do to take care of it. That's where we can help. Tennis elbow typically presents as pain on the outside portion of the elbow. The pain can be quite severe, and I can speak to that because I've actually had it myself. The pain can at times feel as if someone's driving a nail into the bone on the outside of the elbow. So what typically happens is a person will come to the office and complain of this condition about the elbow, and many times someone may not be aware of what exactly caused it. The pain itself may be achy, or it could be sharp and stabbing. When they experience this pain, it can be in the area itself, or it can radiate down the arm, causing achiness. The achiness and the pain in the elbow is typically made worse by our normal activities, the very things that cause us to have this problem in the first place. Those types of activities perpetuate this problem. They make it continue for time, and as it turns out, the condition becomes more constant and worsens. There are various treatment options available for tennis elbow, thankfully. These options include 1, modification of activities. The doctor always says, if it hurts, well, don't do it. Well, as it turns out, it's true. If there are certain activities that cause discomfort that can be avoided, such as maybe playing several rounds of golf in a day, or tennis, or using different objects at work, such as a mouse or keyboard, we could try to eliminate those. But for many patients, they're not interested in hearing this. They would rather find out what else can we do so that we can engage in these activities, especially the leisurely activities or sporting activities. To those patients, we have different options, including the use of a brace. A brace, either what's called a cock-up wrist brace or a counterforce brace of the elbow, can provide dramatic relief. This is a great method of treatment because it's not invasive, it doesn't require cutting the skin at all, and it can be used when the pain occurs and removed for showering or what have you. Another option would include physical therapy and/or stretching exercises. Physical therapy can help to stretch those tendons that are degrading over time, to help to strengthen the muscles and tendons around the area, and to overall help to improve the symptomatology by reducing the swelling and improving the pain response. An additional option would be a cortisone injection. Cortisone injections are typically used for inflammation, and as I mentioned, this process is not truly inflammatory in its nature. However, cortisone injections have still found to be effective to some degree, but I should mention that other injections also help. In fact, our orthopedic literature has shown that simply placing a needle in the area of tennis elbow will bring about some resolution of symptoms. So you'll feel better just with the needling. It makes us wonder what is exactly at work in the process. We believe that the needling and the cortisone injection or additional injections, which are called prolotherapy and so forth, are actually bringing about the resolution of this tendinosis, meaning that that's causing bleeding beneath the skin within the tendon that hopefully is bringing healing factors in with the blood so that we can bring about a resolution of the tendinosis. These are typically very effective, but they can be painful, especially in the short term. If all of these methods of treatment fail, the end of the line is surgery. And fortunately for many patients who have tennis elbow, they don't require surgery because the other methods help quite well. Surgery is typically resolved for folks who have tennis elbow for 6 months or greater and who have failed all methods of treatment other than surgical intervention. So they've had shots, they've had therapy, they've tried everything, they've even given up golf and tennis, and they can't find any way to get better. As it turns out, the surgery is very helpful. The surgery involves a quick 20 to 30 minute procedure where a small incision is made on the outside portion of the elbow. It's a same-day procedure. You go home the same day with a splint. You wear a splint for 1 week, and then we get you back to some of your normal activities. But the tennis and golf will have to wait for probably 3 to 5 weeks.